This video is going to be on lymphocyte physiology, and I have pictured several lymphocytes that you could potentially see in peripheral blood, and the morphology of the lymphocytes that you see are really going to depend on whether you have a small animal patient or a large animal patient. In small animals, most of the lymphocytes that you normally see in circulation are going to be small lymphocytes, and less than 2% are going to be these other forms, which include granulated lymphocytes, lymphocytes with more basophilic cytoplasm, and then also larger lymphocyte. And for size comparison, when I'm talking about large and small lymphocytes, I'm usually comparing the lymphocyte to the size of a red blood cell. So for comparison, this would be about the size of a red blood cell, and you can see that the small lymphocyte is less than 1 to 1.5 times the size of a canine red blood cell. In large animals, they have increased percentages of these bottom forms, so perhaps 20 to 70% of the lymphocytes in circulation will be some combination of large lymphocytes, basophilic lymphocytes, or granulated forms, and then fewer will be the small lymphocytes. So when you see the term reactive lymphocytes on a CBC report, that usually means that there's increased percentages of these forms that I have shown at the bottom: granulated lymphocytes, more basophilic lymphocytes, or larger lymphocytes. Early in life, lymphocytes or lymphocyte precursors, progenitors, originate from the bone marrow, and then if they're T cells, they go to the thymus, and if they're B cells, they mature within the bone marrow and then disseminate to lymphoid tissues, extramedullary lymphoid tissues. The T cells also, after traveling to the thymus, disseminate to lymphoid tissues as well, secondary lymphoid tissues. So in the adult animal, there's abundant lymphocytes in these secondary lymphoid tissues, and a lot of the proliferation of lymphocytes and the lymphocyte kinetics occurs in the secondary lymphoid tissue. So really, when we're talking about lymphocyte kinetics in adult animals, we're not really concerned about what the bone marrow or the thymus is doing anymore, because there's ample number of lymphocytes outside of those two sites. So we're talking about lymphocyte kinetics in adult animals, we're talking about secondary lymphoid tissue, and then the circulation that those lymphocytes do between blood, tissues, lymphatics, and the lymph nodes. So normally lymphocytes circulate in blood. They have a circulating pool, and I'll label that with a C. They have a marginal pool, just like the neutrophils, and I'll label that with an M. And they travel to various tissues, and they look for various antigens to fight against. They can drain those tissues and go back to the secondary lymphoid tissue by way of the lymphatics. And then they can re-enter circulation by way of the thoracic duct, which empties into the blood circulation. So it's this circulation that can, when it's interfered with, can alter lymphocyte numbers in the peripheral blood.